what are some of these treatment options available to treat fertility?
There are various fertility treatment options. The most common of which actually is surgery. This is quite, a lot of people when they think about fertility treatment options, they're always thinking about IVF, IUI or medications, but actually surgery is very helpful. For instance, for certain womb conditions such as fibroids or polyps that might be affecting the chances of a pregnancy implanting in the cavity. So surgery can remove these. Certain ladies have endometriosis, so this endometriosis can form barriers for the egg to get to the tube. So again, surgery may be able to help to get the tubes unblocked and endometriosis ablated. So this is one of the more common treatment options. Thereafter, we also have medications. We have ovulation medications that can help induce ovulation in women who are not ovulating regularly. This is usually 80% effective in getting the lady to ovulate. Thereafter, if pregnancy was to be achieved, usually it will be achieved within 6 months of regular ovulation cycles with consistent trying. We have SO-IUI, which is basically supraovulation, intrauterine insemination. Such cycles are basically just augmented natural trying. What we are trying to achieve in this cycle is to get a few more eggs than one out. So basically we aim to get 3 or 4 eggs out. For the IUI, what we want to do is control the timing of ovulation with again another medication and injection, and then we take the sperm and we put it in relation to that appropriate timing. And so when we take the sperm, we wash it, concentrate it, we shoot it into the womb, so it's much nearer where the egg is in the tube, and then that will help to maximize the sperm concentration around the egg and thereby try to promote the chances of fertilization and pregnancy. So for such SO-IUI cycles, the overall success rate that we usually quote to patients is about 20 to 25%. Now of course this may seem very low, but actually if you compare this to natural conception rates in a lady above 30 for instance, which is not much higher, it's only about 15 to 20%, so you get just a slight augmentation over that. Then of course we have IVF. IVF, I'm sure a lot of people know what it is. Basically, we take the eggs from the lady and then we take the sperm from the man, and then after that we fertilize this in the laboratory, usually via taking a sperm and injecting it into the egg. That is called egg C. And then what happens is that the fertilized egg or embryo will then be transferred back into the lady's womb, and hopefully pregnancy will result. So in IVF, the success rates are better. Overall, it's about 35 to 40%, but cumulatively, sometimes we can achieve more than 50%.
So what would your advice be then, Dr. Tung, to couples who are trying to conceive or that they are facing challenges in their fertility journey?
So first of all, to get help early. So do not be afraid, go seek a fertility specialist's opinion. Recognizing the fact that there is such a thing as a fertility specialist, so that you get much targeted and more specific assessment and help. And then you can get this early so that you can detect potential problems early, and then that will definitely help improve your outcome of your treatments. And then secondly, what you can do is maintain healthy lifestyle habits, include with regards to not smoking, limiting your caffeine intake, as well as exercise, having good exercise, having an active lifestyle, and good weight management. These are some of the things you can do. You can also take some multivitamin supplements, as well as antioxidant supplements to help improve your egg quality as well as your sperm quality. And most importantly, I always advise couples to have good communication with each other and good support. They should try to do activities outside of just trying to make a baby as well, things that they like to enjoy.
Thank you so much, Dr. Tung, for sharing so much helpful and useful insights with all the couples out there. So to all the couples out there, if you're trying to conceive, all the best. Please do take care of yourself together with your partner. Thank you again, Dr. Tung, for sharing your time with us.
Thank you very much, Kelly.
So earlier we heard from the Western medical perspective on infertility. Now we're going to explore from the TCM perspective what infertility exactly is. To share with us more about that, we have here with me Senior TCM Physician Ho Chin Yi from Thomson Chinese Medicine. Thank you for joining us today, Physician Ho.
Thank you for having me.
In the TCM perspective, what exactly is infertility?
It is the inability to conceive after 1 year of unprotected sexual intercourse.
What then are the treatment options in the TCM perspective to suit all these ladies who are at different points of their trying process?
Okay, so usually we will use acupuncture, herbal medicine, sometimes moxibustion, either for them to do it at home or in the clinic, and then we'll provide some lifestyle and dietary habit changes if it's required. Yeah. So for example, for those who are early, like just seeking before they do any of the health screenings, right? We'll usually be more on using herbal and acupuncture because we are like sort of the lead in treating the patients. And we do that to correct the imbalances in the body. As for those who are undergoing, like say IUI, IVF, we will complement the treatment from the Western perspective. So we'll usually just use acupuncture, no herbal medicine, because sometimes we are not sure about whether there's any drug-herb interactions and so on.
So Physician Ho, how does one get started with fertility treatments at TCM?
So usually we will encourage both the couple to come to the clinic together because it takes two hands to clap, right? So we'll go through the TCM consultation with both of them and then identify some of the, say, lifestyle changes or dietary changes that they might have to take. And then at the same time, according to their condition, we might prescribe acupuncture treatment or herbal medicine for their condition. Then for some of them, we might also encourage them to go for the fertility screening with the doctors so that we can get a more objective idea of where they stand at that point in time. So that will make the whole treatment more fruitful as well.
After all these treatments are administered, right, how long does it take to see results or improvements?
Okay, so we usually go for 3 menstrual cycle as a treatment course. In between, of course, every visit will be doing consultation to look at how they are progressing. So it really depends on patient to patient. We have some who really come in for 1 or 2 cycles and then they got pregnant, and then some took a while, and some had to eventually do IUI, IVF, and so on.
So Physician Ho, now that for ladies, the age of wanting or trying to conceive is slowly increasing, based on your experience, do you see a lot of ladies in their 40s coming to you to seek fertility treatments, and how would you usually manage it? Are there any unique cases that you have seen?
Yes, we do see increasing number of ladies after 40s coming to TCM to seek help for their fertility. So some of them already have the first one and then they're thinking like, I want to try for the second one, and then others are still trying for the first one. So there's a group of them who are also doing IVF, IUI, either in between the treatment cycles they come in to get a boost, or they're trying to get a boost before they go into the IVF, IUI treatments. And then some of them are seeking like just pure TCM help to improve the chances.
What would you recommend the diet to be for couples who are actively trying to conceive?
So we always advise our patients to, number one, cut away the processed food. Then, of course, from a TCM perspective, we like everything warm. So actually with age, right, our TCM spleen system, which is the digestive system, will weaken. And then, so one of the things to do on a daily basis to help preserve its function is that we can drink warm water first thing in the morning, take sips. So that will help with the digestive system. And then also we will advise them to take fruits that are high in antioxidant. So, for example, mulberry is actually a T-stem herb that we use that can nourish the T-stem kidney organs as well, which is related to fertility. And then raspberry as well. We will advise them to cut down on the cold and raw food as well as the spicy ones, because these are the two extremes that will easily cause imbalances in the body.
I know that Singaporeans, we love our sashimi.
Yeah.
So actually not advisable to take too much. Once in a while is still okay.
Yeah, I mean we have to keep the lifestyle and dietary changes sustainable. So on and on, want to take it is fine, but not too often, not like a weekly or even daily thing.
Thank you so much, Physician Ho, for sharing all that information with us.
Thank you.